Good afternoon and welcome to Saturday Sesh. My name is Trey Reckling. I'm the founder and the director of Academy of Cannabis Science. And every Saturday, typically on the first Saturday of the month at noon Pacific, we have something like this called Saturday Sesh, where we invite smart friends of ours to come in and talk about their involvement in the cannabis industry, what they're doing, what they're passionate about, and why we should care. Today, we are so pleased to welcome Dr. Alison Draisin from the Ames Institute. Dr. Draisin, welcome. This is your first time on with us, and we're so glad to have you. You're still muted.
Thank you so much. I'm honored to be here.
So tell us a little bit about you. I said I just gave a thumbnail. We know that you work at Ames, but tell us more specifically what you're working on and what we should know about you.
It's a mouthful. I have been a psychologist and psychotherapist for nearly 30 years. And I know Trey I know you from beginning in the cannabis industry. I know I was a part of the cannabis industry back in 2008, 2009, doing activism work. I started an edible company called Ediluz in 2010. Ediluz, the mission was really to heal patients, and the focus was on patients, where we employed FDA labeling and packaging back when people were still using saran wrap in the stores. And that was my mission, was to, make cannabis products that patients could use, that were healthy, that were packaged appropriately and presented with appropriate dosing. And I pell-mell, roly-poly, I've, been heavily involved in cannabis education because I wanted to teach people more about the use of cannabis as medicine through the Ediluz edibles line. And then medical kind of died when recreation came about, and it was not my forte. I was not really interested in selling my soul to a devil for recreational markets. I totally believe that everyone deserves to have access to this plant. My focus was really on helping patients. And so I found myself in a limbo, and I reconnected back with doing psychology work. And at the 2018 Seattle Hemp Fest, Dr. Sunil Agarwal approached me and was like, we're starting this institute called the Ames Institute, where you'll be able to actually do cannabis assisted psychotherapy and ketamine and psychedelic assisted psychotherapy. And I was over the moon, because then I could still help patients, but not with like a consumer product, but instead help them to choose products on the market and for health and wellness. And we do things a little differently. I'm sure you'll be asking me some questions about the cannabis assisted psychotherapy, so I'll wait on that. But that's kind of where I'm at. And so I've been at Ames since 2018, and I'm the lead psychotherapist and also the director of ketamine assisted psychotherapy provider training. And we're launching, myself and another clinician from the Northwest Ketamine Clinic and I are launching a professional psychedelic provider association to provide continuing education and support for psychedelic providers. Also working with the Synaptic Institute in Oregon to help them devise a psychedelic trainer program, because they are in the process of developing regulations for their regulated psilocybin market. So that's what's on my plate.
Wow, that's fantastic. So before we dive deep, could you tell us a little bit about what is cannabis-assisted psychotherapy? How does that play out?
Cannabis-assisted psychotherapy, most people think, oh, well, I open up, I become vulnerable when I use cannabis. I sit on my couch with my friends and we get into deep conversations. And so it's combining that premise of how cannabis can make you vulnerable and open to reflection and change. And also, I also use cannabis to push people to explore the things that might make them uncomfortable. So I hear people say, I don't use uplifting or sativa type cannabis because it makes me paranoid or anxious. What I actually do in my office is I work with people to choose the correct cultivar for them, and then they bring it into the office. It might not be a cultivar that they normally use. It might be out of their comfort zone. And we have them we vaporize, whether with a handheld vaporizer or with a volcano in our office. And we allow for that vulnerability and for reflection, but I also look for that period of anxiety or paranoia. And we begin to explore while the paranoia and anxiety is going on to examine what is the root cause of that anxiety. And it's really amazing because it allows people a safe place to explore those anxieties and the things that might kind of make their brain skip a beat. We also use cannabis-assisted psychotherapy for novice users who want to try cannabis in a safe environment. A lot of times they are older clients who come through AIMS that are oncology patients that want to try cannabis but maybe have never tried cannabis in their lives. Doing cannabis-assisted psychotherapy enables them a safe, secure place to explore cultivars that work for them, and where that they are with someone and they have guidance.
That's beautiful. And it makes all the sense in the world. I know personally, I used to get paranoid after I'd use cannabis and go into public. And at some point it became, I don't know what the switch was, but I was like, well, for one, I was living in Georgia and things were a lot tighter lockdown and there were serious repercussions for getting caught using cannabis. But at some point I was like, well, I don't care if anybody knows, or I had to kind of deal with my anxiety. So do you find that some people who are able to even enjoy the act of using cannabis more freely after going through psychotherapy like this? It kind of loosens some of those bonds?
Well, first I'm going to say that the reason you probably got some paranoia and anxiety is because you probably didn't know the cultivar that you were using, and that you were probably just having to take whatever you could get. And so without knowing the cultivar that you're using, now we're able to do that. You're gonna have to take what you can get, and you don't even really know what to expect of the feelings that are going to come from that. So now we know. Now we have a greater understanding with cannabis science about terpenes and about the different cannabinoids and the balance in the different cultivars of those cannabinoids and terpenes, and how to select the ones that are best for you. When I work with clients who are looking for at-home cannabis, I usually, someone who's really anxious, I don't want them going home and using something that's high or uplifting with high limonene. I want them to use something that's more myrcene or more sedating. But finding that balance where they're not completely sedated is where that key comes in. And I work with those clients to do that. Did I follow what you were?
Sure thing. And so for the uninitiated, or for people who haven't been in our classes as deeply yet, when you say cultivars, that's what other people might refer to as strains, right?
Yeah, I don't really care for the word strains, because strains are like viruses and bacteria. Right. And so cultivar is more of like a botany term to represent like plants.
I'm in full agreement. Yeah, the negative connotations of strain are many. And cultivar is consistent with other botany. Yes. And so
I was going to add something to what I said. Is you had asked about, if there are shifts with people. I will tell you, when I sit with people doing, we call it CAP with a C, cannabis assisted psychotherapy, they ask a lot of questions. They ask a lot of questions about cannabis. They want to explore, wow, this makes me feel this way. They talk in detail about, I feel it in my head. I feel it in my nose. I feel it in my chest. And oftentimes it makes them want to explore more after our sessions. And it gives them that level of comfort that they can begin to experiment and become connoisseurs, if you will.
That's excellent. So do people generally come to you and say, hey, I'd like to use cannabis as related to my therapy, or is this something that you might bring up as you have people who are existing patients say, have you ever considered this? Do you get both?
So oftentimes it's on our website at
Mhm.
theaimsinstitute.net. And so when people are looking us up for, oftentimes they're looking up for psychedelics for the
Mhm.
ketamine assisted psychotherapy, and then they'll come across the CAP. And we'll do consultations with people who, depending upon what issues that they're looking to work through, some people really should go directly to a psychedelic instead of just playing in the waiting pool with the cannabis. Those are people who tend to have more complex traumas, deeper trauma backgrounds. For basic depression and anxiety, it's absolutely fantastic to start with cannabis and then work your way into the psychedelics. But we have a consultation and before we move forward to discuss what a client wants to do.
That's excellent. So you brought up psychedelics a couple times, and for some people, psychedelics are scary, right? They're unknown, or people are concerned that that might trigger some kind of psychotic episode in themselves, or make them lose control, basically. What kind of conversations do you have around psychedelics with the uninitiated when you bring this up, or somebody says, I'm interested, but I've got all this bundle of anxieties around doing this? I know it's a much longer conversation, but what are some of the keys that you're talking about with patients?
Knowledge is power as far as I'm concerned. And so a primer that I usually always recommend all of my clients coming in to do psychedelics, especially if they're psychedelically naive, is Michael Pollan's book, How to Change Your Mind. It's just an all-around great book that discusses like Michael's use of different types of psychedelics to alter his mental perspective. And I also give when people come to us who are psychedelically naive, even though they're psychedelically naive, they've done a lot of research online about the didactic work about psychedelics. And so in my prep session, I will give them an indicator of what to expect about shifting from one reality to another reality, what that feels like, and how I'm there to ground them and to support them. Now, interestingly enough, I did psychedelics as a kid, and going to concerts. My new phrase now is festival psychedelics. People who like to go before time, before the pandemic, when you could go to a festival or a concert and try some MDMA or try little mushrooms. But what we do now in using psychedelics for health and wellness is a shift from that. And when clients come to me and say, oh, well, I've done them at festivals, I have to really let them know that it's very different doing psychedelics for mental health and wellness. And that's because there's intention, and there is focus on set and setting, and there's also integration. And all of those concepts are about, putting boundaries around an experience so that it provides safety, security, comfort, as well as the ability to allow someone to explore in that environment some of their deepest, darkest, feelings and emotions.
And if people on the call are not familiar or haven't been following the fast moving trend, Johns Hopkins opened a Center for Psychedelic Research in the last 5 years. Medical University of South Carolina opened a similar program. Of course, on the West Coast and Harvard, the studies kind of never stopped after Timothy Leary, even after Timothy Leary scared a lot of folks with his kind of more circus approach to psychedelics. And then Michael Pollan's book, like you mentioned, there's been an incredible groundswell of interest, not just for the sake of interest, but because people are seeing tremendous benefits with just a few applications. Could you talk to us about that? Because I think a lot of people might be aware that this is also often ancient medicine. These are medicines practiced by people long before
Indigenous
before,
people.
yeah, indigenous people, long before these modern uses. But could you talk a little bit about how it can be that sometimes only a few experiences can have tremendous benefit or tremendous effect?
Well, that was a loaded question because there's a whole issue with regard to Indigenous people and how Westerners are now utilizing psychedelics for health and wellness. And there's a lot of controversy
Mhm.
that is being addressed at some of the psychedelic conferences with Indigenous shamans, and it's an issue. We definitely try to be sensitive to those issues in our clinic. That's something that's on our forefront. Is we try to pay homage to the Indigenous people by incorporating aspects of ceremony into our practice. We play singing bowls. We have chimes. We burn Palo Santo and sage. So it's a little different than, like, just going to a regular doctor's office. We really are trying to bridge what has come before into our practice. Now, as far as psychedelics, I've been a therapist, psychologist for 30 years, and psychedelics are the best tool in my toolbox. I got my master's in art psychotherapy and my doctorate in clinical psychology. And so I have a huge toolbox of things that I can employ, different modalities. Hands down, psychedelics are the best tool. It combines 7 to 10 years of psychotherapy into maybe 3 sessions. It is the fastest movement I've ever seen. And I attribute this to, I like to say that when you're doing psychedelics, it's like your conscious mind is sitting down to have dinner with your unconscious mind. And you're getting a chance, your conscious mind gets a chance to see what's been on the menu all these years, and why, and how to maybe switch menu options, and being more comfortable with switching and making different choices, as well as, especially for trauma patients who have been carrying around trauma for many, many years, it allows them the opportunity to let the trauma go. Now, it's not a mind wash. It doesn't make you forget that it ever happened, but the emotional component that it's attached to those traumatic experiences, it's like a wet blanket gets put over them, and it doesn't hold as much emotional pressure as it may have in the past. It also, I see people who find joy where they never had joy before in their lives. I see people who are now able to be present with their families, their children, who may have, we all know those people who are all in their heads and who overthink, and oftentimes get caught up in the overthinking, and that causes depression and anxiety. Using psychedelics really helps people stay in the moment and be present, and not allow those issues to overpower them.
Thank you, and thanks for bringing up the whole issue of colonization of psychedelics. Anybody who's interested, we encourage you to check out the Chacruna Institute, Chacruna Institute.net, I believe, who does a lot of great work and education around that and indigenous use and respect for indigenous cultures and that sort of thing around this, and really is so important because right now we're seeing, just like we saw with the green wave and people all interested in cannabis just for the monetary reasons, we're certainly seeing the same thing when it comes to entheogens, which is another name for psychedelics. And so we encourage you all to find balance and not get swept up in the hype of this, and certainly not to believe that you can just go it alone at home and have the same experience you might have with a licensed therapist in a controlled setting. So could you talk to us a little bit? You talked to us about some of the practices in the office, but when somebody's preparing for their first experience, I've gotten to go and see your flight chair. Dr. Draisin actually has a flight chair in her office. I don't know if that's what you call it. Just
I make my office, which is actually different from the other offices at Ames. I have like a tactile furry rug. It's a really big, like leather recliner that goes all the way back. We have blankets and pillows. I have a Himalayan salt. I have some other sacred objects in the room. And I try to make it as homey as possible and comfortable as possible for people to explore. Environment is really important to the process. You know, like I said, festival psychedelics, you are out with lots of people, there's music coming at you. When you're doing it for health and wellness purposes, it should be something that's more internally focused, something where your environment is quiet, where the person that's sitting with you is quiet and uses a quiet voice so that you can focus inward. We have our clients where Alex Gray is a psychedelic artist, and he developed what's called a mindfold, and it blocks out the light, but it also allows you to focus inward. And it has like styrofoam pieces around the eyes so that you can still open your eyes, but it's still dark. And so we utilize those to help people focus inward on their journey and to internalize the process. We also have them wear headphones and we play specific music. Music is really important to the psychedelic psychotherapy experience. We do not use music. Actually, there's courses on, like, you know, the use of music for this type of therapy work. And, you know, some of the basic concepts is that there are no words. And they should not be songs that are recognizable by you, because you don't want to, you know, say your favorite song. That's not necessarily the most appropriate song to do an inward journey. It's about something that's novel, that's going to take you on a journey. And we have our music is specifically curated for each different journey. Usually people do about 3 journeys. And then we move them from our office to doing at-home lozenges. We follow them with integration, and then they'll come back in quarterly for re-ups. I also want to make sure that I add that psychedelics are not just for depression, anxiety, and trauma, but they're also really amazing for addiction and for harm reduction. I work with a lot of clients who have alcoholism or drug addiction or even food addiction. And the use of psychedelics has really helped them to curb their cravings for whatever that they are addicted to.
And a lot of people aren't aware that originally the founder of Alcoholics Anonymous wanted to use LSD as part of the process for Alcoholics Anonymous because he found that substance so beneficial to himself, and the other people that he was working with said that's not going to vibe with the way we see this program. But anyway, thanks for talking about that, and thanks for talking about the legitimate professional practice, because there's certainly a lot of ads and opportunities for people to go overseas or go to this exotic location and that exotic location, but trust is everything, and finding people you can trust to work with is essential, because there's certainly some scary stories out there where people have put their faith in someone who was not worthy of it. And certainly you're at an incredibly vulnerable state. So you have to be around people you can trust and people who are going to care and love and support you in every way that's appropriate. So
I just want to add something. And so what we do intramuscular injections. There are lots of ketamine clinics out there that are run by anesthesiologists that do IV. And I say this is to make sure, if you're looking to do this type of work, I recommend doing it with a therapist. I've worked with lots of clients who've come from these IV clinics where they are hooked up to an IV and left alone in a room, a very sterile room. They can bring their own music, they can bring their own eye patches, but they are kind of on their own journey without a lifeboat. And then they end up coming to us because oftentimes they're traumatized by those experiences. So I agree with you, Trey, like having a certified or a licensed psychedelic provider is really important. You know, I do know there's a lot of people doing underground work, and some of them are good and some of them are not so good. And unfortunately, because they are underground, it's not like we have a Yelp for underground psychedelic providers. And I think with more attention to this and more legalization, you will be able to find those. Like we were talking before, Oregon is in the process of developing regulations. They are allowing people to be guides as long as they have a high school diploma. That's fine. I think that if you take coursework and you can become a guide, I think it's open to anyone that can do this. But part of what we're teaching in the training for Oregon is the basics of developing a therapeutic relationship, having mindfulness, looking at what we call transference and countertransference, which is when, transference is when the client may project their own issues onto the therapist, and countertransference is when the therapist's issues come out onto the client. And those are things that are really important, regardless of whether you're a therapist or you're just a bachelor's level or even, a high school graduate level guide. It's important to maintain that space with some of those basic skills. And so it's look for that, ask for that.
Thank you. And y'all forgive me. I'm personally interested in the subject, so I know many of you are cannabis focused. And so if we dove down a deep rabbit hole that it isn't your particular interest, thanks for being patient. But I find the whole subject matter fascinating, especially patients that are seeing benefit. Jada, I want to ask you, do you mind asking your question? I see you wrote in the chat, but would you like to represent that yourself?
Yes, certainly. Hi, I'm Jada, and I am a medical cannabis consultant. Soon to be, I'm finishing up my course. And I guess I'm just curious how those of us that are interested in medical cannabis on our side, how we can help as far as maybe referring patients that might have similar issues, finding clinics like Ames. I'm not necessarily close to that area, but I don't think that there's a whole lot of resources for this kind of a thing. So I guess I'm just, what kind of advice or suggestion you have for somebody in my position that's looking to try and help our patients in our demographic. Thank you.
I have patients that come to see me from Maryland, Texas, California, Montana. I've had a client from Nevada, and we do part of our sessions via Zoom, and then the actual experience is in our office. And so they will come and spend the night in Seattle and have their session. I don't know of any other clinic that does cannabis-assisted psychotherapy the way that we do. And I've talked to there's a woman who's a PhD candidate in Utah, and she and I spoke recently, and she's spoken to 40 different people across the country that are doing cannabis-assisted psychotherapy, but none of them actually talk about cannabis, which is really weird to me. They don't talk about which cultivar to purchase. I think that we're the only ones that actually support the client to choose the appropriate cultivars that are best suited for psychotherapy and best suited for their own needs. So I would say that I don't have any other referrals other than Ames. So
that's completely fine. I've been reading about some of your work and the stuff that you guys do at Ames, and I just think it's really great. So.
And I will tell you, one of the therapists that we have on staff, she started out as a medical consultant at a dispensary in the Washington area. And she found that that there was more of she's not allowed to do therapy as a medical consultant, but that clients wanted that. And so she ended up going to Bastyr University and getting her master's. And now she's working with us, and she's able to use her knowledge from her medical cannabis consultant days as part of her practice at Ames.
That is so fascinating. I actually have a 12-year background in healthcare, and I'm really excited to be getting into this, and I've just, like I said, I've been reading about your work, and it's just really exciting stuff. So thank you for taking the time to talk about it today.
Thanks. I'm excited. I like to talk about it.
And thank you, Jada. Those of you working in retail, the role that you play is critical. For one, you know, a lot of patients and just recreational users come in and just ask sativa indica hybrid questions. And those of you who know that that's a very pedestrian and inexact and not even helpful language, really, when it comes down to it. You know, we hope that, and if you're in the retail space, you are talking about terpenes. We hope you're talking about cannabinoid profile, cannabinoid ratios. You're helping, like Dr. Draisin said, helping people to find those cultivars that benefit them, not just what's hot, not just what's on sale, and certainly not just what's high THC percentage. There's so many other questions, and the more you can educate them, the more that we all have smarter consumers, and smarter consumers mean we have a broader base of products on the shelf. So it's not just all high THC stuff when you go into a store, because certainly many of you know on the call that that's one of over 100 plus compounds in the plant. And THC is important, but it's just part of the symphony, right?
I can't tell you how many people come to my office. I'll be doing their evaluations or their consultations, and they're like, I've tried every cannabis strain my bud tender recommended, and it all makes me paranoid. And I'm like, well, then maybe you should tell your bud tender that, you know, can you recommend something that's not going to make me paranoid? But I'm sorry, but bud tenders don't always have that education. And,
Yes.
you know, when I'm always disappointed when I hear clients come to me and say that, well, the bud tenders told me to buy this, this, and this, and I spent like $200 and none of it worked. And so it's always really heartbreaking for me, because I just don't know if general bud tenders beyond medical cannabis consultants, if that they are trained. And when I've talked to different retail providers about it, they usually tell me it's cost. You know, they're not able to take out 280E taxes, and so they don't really have a whole lot of wiggle room for training. And it's disappointing.
Yeah, so much love to those of you who are going over and above, whether or not with employer help or otherwise. You're certainly taking your time regardless.
Oh, yeah.
So thanks on behalf of patients and like we said, not just patients. We know that all cannabis use can be medical if the intent and focus is there, right? And so what other questions? I've dominated Dr. Draisin's time. What other questions do you all have?
I have one more question about something that I recently had found. I believe it's called Endocanna, and it's they say it's a DNA test that you can take that tells you what your cannabinoid and terpene profile and needs are. And I was wondering if you guys had heard about this or anything like that, or what your thoughts are.
There's a group out of Israel and a local group here in the US who's doing some of that work. I think it's very interesting, and it holds a lot of promise. To me, it just feels early still. You know, there's so much that we still don't know. I think in time, it might be not just for cannabis, but for just so many things.
Yes.
In our diet, it's going to be important considerations. I always want to urge caution when you're giving up DNA samples, though, whether it's to Ancestry.com or some other program. You give up DNA samples, your DNA is out there on file with somebody. And not to be paranoid, but we don't know how they're going to use it or how they might share your information. So that would be my first caution with something like that. But I think the intention, if pure, is very interesting, you know. Anybody else? Questions? Because I've got more.
So do you ever find yourself doing like combination therapies? Is that a thing where you're doing ketamine assisted and cannabis assisted, or psilocybin assisted and cannabis, or ketamine and psilocybin, or mixed therapies? Is that something that you do?
Since we can't do psilocybin in our office, I can't speak to that, but I do have clients who tell me that they are doing both. I often recommend when people are coming down off of ketamine, if they're already users, most of them have vape pens. I will say, you know, because sometimes when you're coming down off of ketamine, you can have some nausea. Just yesterday, I had a client who was having some nausea, and I said, "Do you have your vape pen with you?" And he was like, "Oh yeah." You know, I said, "That'll be great for your ride home." So, you know, and with regard to it, the ketamine assisted psychotherapy in our office, if they have like residual nausea or headaches, then I will recommend, you know, cannabis. But I can't say it has to be done as a suggestion. I can't tell someone as a prescription because it would impact my my licensure. I can make suggestions, you know, because I'm supposed to be an expert in mental health, not an expert in cannabis. So I have to be very careful. We are not currently combining, we don't currently have someone use cannabis and psychedelics in our office.
And when you say for the ride home as a passenger, right? Because I know that you recommend that somebody drive you home from ketamine.
Yes, I meant as a passenger. Yes,
Yeah, okay.
Thank you very much for clarifying that. Yes, that we do not allow people to drive home after a psychedelic session.
Thank you.
And you know, I should have asked this question a while back, but ketamine, for people who aren't familiar, was originally a tranquilizer, right? And often used by veterinarians, but not just veterinarians.
Not just veterinarians, it's used in hospitals as an anesthesia. It's been used as an anesthesia for quite a long time. So for humans and for animals, it's a sedation tool, and it's used in our office. You know, it does have some sedative properties, but it also has dissociative and psychedelic properties. And so there's a dosage that, you know, we have a parameter of dosage to keep someone in that psychedelic. You know, it's a higher dose, which is considered psychedelic. A lower dose is considered psycholytic. A psycholytic meaning that there is less of an ego dissolution and people can actually talk. They're not sedated to the point where they can't talk. And so oftentimes we will do lower dose ketamine and do therapy sessions while people are open, feeling a little less restricted. The clamp around their neck, where I say the flow between the heart and the head is a little more open, whereas like on a higher dose, people are you go into outer space. For lack of a better word, you're going to the outer space, the edges of your unconscious, you're plugging into the matrix. Everyone has different words for it. It's a separation from this reality into the reality of your unconscious mind. So
if I could do a callback, you said, you know, it's frustrating to hear people that go into a dispensary and spend a couple $100 and still didn't found anything that's right for them. I know that you also serve occasionally as a judge for cannabis products, and you're currently doing that now, right? You're doing anonymous reviews for a competition. Could you tell us a little bit, as a professional, what are some of those things you're looking for when you're evaluating products like that? What are distinctions between one and another?
So I should at least give my experience as to how I became a judge. When I had my edible company, I won a bunch of High Times awards. And so when you win High Times awards, they bring you in as a judge and they teach you how to judge cannabis. And so I've been judging cannabis for High Times. I've traveled to Mexico for cups, Amsterdam for High Times. I was the judges coordinator for the Terpestival, and I've judged Sun Cups. I have a lot of weed that I've judged, cannabis, excuse me. So this year they asked me to judge the Washington Craft Cannabis Cup. And so I have several categories. And so I think you want me to kind of touch on how I judge. So when I was the judges coordinator, we came up with a whole scoring system, and the basics are appearance, aroma, appearance, aroma, taste, effect, smoothness. And what I usually will do is so like I have an entry here. And can I open the entry? Oh no, they decided to. What I do is I'll open it. So we opened it. And then I have this little scope. First I'll break it up and then I'll smell the inside to get the essence of the plant. And then I have this little scope here. And it has like a light on the end. Let's see if I can get the light to. My bulb is burst. So my light doesn't work, but it's a little scope. And so, you know, I hold it up to the plant and I will evaluate the plant. Sometimes you can find fibers. Sometimes you can find animal hairs. Sometimes you can find mites. Sometimes you can find, you know, trails left over from spider mites, or you can find dung left over from pests. I always scope it before I smoke it. I do that with everything I smoke because I have seen way too many specimens of cannabis with gross things in them. So this comes with me everywhere I go. Like I have a little judge's kit, you know, and this is on my counter every time I get, you know, any kind of new cannabis from somebody. And then what I do is, like I said, I break it up and I smell it. I tend to be, I'm a joint smoker. And the reason why I'm a joint smoker is because I enjoy being able to look at the ash. I also like to check the flavor. I call it the dry hit, to see if the dry hit matches the lit hit or the smoked hit. And if it doesn't, that's not good. That's not good in my eyes. I would give that a lower score on flavor, because you want that, the grower should want the flavor of the dry hit to come through in the smoked hit. I'm also looking at the ash. I use elements for my rolling because they're really thin rice, and so that when the cannabis burns in the joint, it should, if it's clean, leave a white ash the whole way through. If it's not a white ash, then I question such things as, you know, has it been flushed? Does it have contaminants in it? And I'm sure that Sarah Jack could also speak to this as well. And you know, I don't mind smoking something that might have like a gray ash, but if it's a black ash, I won't smoke the rest of the joint, because that concerns me that it hasn't been flushed, that there's something still in it that is leaving that dark ashiness. And then I sit back and I will, what I like to do is see what the cannabis, for the effect, I like to see what the cannabis makes me want to do. Do I want to do yoga? Do I want to journal? Do I want to sit and veg in front of the TV? Do I want to go for a walk? And then when I'm judging, I actually write this down in my comments to let the people know that this is what it made me feel like doing. And so for this competition, they've given us enough entries and they've given us enough time that I can actually play and sit with an entry for 2 days, so that I can see, you know, when I wake up, how does it make me feel? Does it make me feel different for when I'm waking up versus before I'm going to bed? And all of this is stuff I put in my comments. I try to give as many comments to the growers as possible, because I feel that my comments can make them, whether it's a grower or a processor, can make them better at what they're doing. If that's, you know, you assume that when someone's entering a competition that they want that feedback.
I have found my dream job.
It's fun. It's fun. But you know what? It's actually, I know this is a terrible thing, especially for someone in Georgia. You're like, it's actually hard work. You know, I mean, you should see, I have like notebooks of just notes that I take about the entire process. And it's kind of nauseating, because it's like, I mean, I record everything, because if someone is going to grant me the honor of, you know, handing me their cannabis and saying, here, you know,
tell me what it does.
You know, tell me what it does, tell me how it is. I'm going to give you as much as I can back.
That's
And-
awesome.
And
Dr.
I thank you-
Allison, you're so cool. You're so
And thank
cool.
you for making me a smarter consumer, because as after you invited me to be a judge and work with me through those protocols, I've been a more discriminating consumer and asked different questions. And I encourage all of you, don't wait to be asked to judge. Think one thing, having a loop.
No,
Having a
don't
little
wait.
magnifying glass, you can do that now. And I think it's a great process. When you grind your weed, smell your grinder or smell that fresh ground bud. Notice, how much moisture is it? Can you just crumble that bud in your fingers and it turns to powder? That annoys me personally, but it still has some good stickiness to it, right? Does it have some good moisture quality?
Yeah.
Mary, I think did you have a question earlier that I missed that you couldn't unmute yourself?
Oh, I may have. First of all, thank you. This is just what I've been looking for. I don't want to hog here, but I am a nurse practitioner, but and I'm moving into other ways of healing, and I'm also studying Jungian and Jungian studies out of Switzerland online, and I've been very dissatisfied with. I just see that I think you could really join some Jungian stuff with psychedelics, and that isn't something that's happening yet there. But I'm looking up this Ames. It's in Seattle. Oh my gosh, would I want to work with this group? Apprentice or something. Is there any possibility of any?
We offer.
I have your ear.
We offer observationships, practicums, and internships. Practicums and internships are usually for people who are in school, but we have our provider training program for the ketamine assisted psychotherapy. And one of our clinicians actually studies JAMP, which it's a type of Jungian work that involves movement as well. And so she employs her Jungian studies in her practice of the psychedelic assisted psychotherapies. And actually that's one of the things that in we're teaching providers and competencies. One of the fifth CIIS, which is out of San Francisco, Janice Phelps wrote an article almost 10 years ago in the Humanist Psychology Journal, and she talks about 6 competencies, and the final competency is being able to have other modalities such as Jungian, psychoanalytic, art therapy, music therapy, somatic therapy, so that you can be able to incorporate those into part of the integration work and to expand. It's really the use of psychedelics can really help people expand their concept of traditional therapy.
Yeah.
So yes, if that answers your questions, we do have observationships and training programs.
Okay, who do I write to find out more? The director? You? Okay.
I'm the director of training.
Okay, I will write. Thank you.
I'm going to put my in the chat. I'm going to put my email address.
Great. And while you're doing that, if we could just get one more question, I think we're running out of time, but Jody's had her hand up for a minute and I didn't turn to you first. I'm sorry.
No, that's okay. It's funny. The last 2 questions are perfect framework for my question, which was or is, is there kind of a framework that's come together for helping a client to prepare for an experience and also to process an experience? Yeah, like how do you, what kind of alternative therapies would help them to provide a stable framework for doing this work and then continuing the work in a conscious way?
Any type of therapist can do this work. It's the basics of, developing a therapeutic relationship. The main component of developing a therapeutic relationship is that development of trust between 2 people. And that is the basic, that's the basic component that you need to do this work. There's others, as far as being able to empathize and reframe and mirror your client. But You know, my initial training for my master's was in psychodynamic work, and I employ all aspects. I mean, actually the focus I use now is patient-centered, and so it's then when I do integration, I just meet a client where they are. If they need more work on family systems, then we do family systems work. If they want to, you know, look at their shadow, we do shadow work, you know, as per Jungian. It's really about where a client is. You know, a lot of our clients come to us having done a lot of therapy. You know, I definitely will say that CBT is not one that I use very often. Cognitive behavioral therapy. And I can't tell you why. I just don't really use it as often as just as I do with my person-centered type work.
And Alison, I want to thank you for your time. Please, I apologize. I know you had your hand up as well, but we have run out of time. Dr. Draisin has entered her email, though, in the chat. So if you wanted to reach out to her, thank you for being generous enough to do that, Dr. Draisin. Thank you for your time today. I think the work that you're doing is not only pioneering, but fascinating. And I hope many patients come and are able to benefit from the work you're doing, and the work you're doing indirectly by training the trainers, training the therapists. So that's just fantastic. We're really proud to call you a friend of the Academy. And we want to welcome you all to come back every month for these Saturday sessions. We have our next Saturday will be the first Saturday of February, where we're going to host Brittany Parker. Brittany is the founder of A Green Legacy. You can find them on Instagram under A Green Legacy. She's in marketing and communications. She's a consultant, a writer, and a cannabis and entrepreneur advocate. She's helping a lot of people, especially BIPOC people, get a footing in this industry where it's a really challenge to get started, and can be and there's a lot of uphills and a lot of cost prohibitive things in the way that keep people from being part of licensures and being able to have some ownership in this business. So we hope you'll join us for February when we're going to have Ms. Parker here. Thank you all so much. Thanks again, Dr. Draisin. So grateful to you. And thank you all. Have a great weekend, and we hope to see you back soon.